today?
Good, how are you?
Good. My name's Rachel. I'm going to be taking care of you today. Can you tell me your first name?
Emily.
Nice to meet you. How are you doing today? What are you doing here?
I'm here for my annual physical.
I see. Nothing else going on right now?
Nope.
Any respiratory symptoms? Sore throat?
Nope.
Cough? Stuffy nose? Earaches? Any shortness of breath?
Nope.
Any chest pain?
Nope.
Any nausea, vomiting? Fever, chills?
Mm-mm.
Okay. You said no upset stomach or anything like that?
Yep.
How's your diet normally?
It's good. I eat about 3 meals a day, vegetables and fruit. I try to with every meal, and then I've been better with my water intake.
Good. Any caffeine?
Rarely, sometimes before work.
What do you do for work?
I'm a nurse. I work overnight.
Oh, nice. So sleep, is that difficult for you?
Yeah, but I try to get like at least 6 to 8 hours of sleep
Oh, good.
a day.
And what about exercise? That must be difficult too sometimes.
Yeah, I try to do like 3 times a week, but sometimes it kind of fluctuates. So.
Good, good. Do you drink alcohol?
Sometimes, like on the weekends, probably like twice a month, I'll have a drink or two. So.
I see.
Yeah.
Any recreational drugs?
Nope.
Marijuana?
Mm-mm.
Do you smoke tobacco?
Nope.
Okay. Are you sexually active?
Yes.
One or multiple partners?
One partner.
Okay. And do you use birth control?
Yes, I'm on the oral contraceptive, and then we also use condoms.
Okay, so that's good because if you smoke with oral contraceptions, you're at increased risk for blood clots. So it's very good you don't smoke. Do you see a gynecologist regularly?
Yes, annually.
So you're up to date on your pap smear and your breast exam? Do you see a dentist?
Yes, that's twice a year.
Okay, and you get your eye exams?
Yes, every year.
Every year, okay. Do you see any other specialists for anything?
I see an endocrinologist.
And what do you see him for?
I was diagnosed with Graves' disease back in 2016, September of 2016. They found out that my TSH was less than 0.01 and my heart rate was very fast, so they ended up putting me on Tapazole, which is like an anti-thyroid medication.
Mm-hmm.
And I ended up breaking out in hives, so they had suggested that I should just have a total thyroidectomy, which I had in October of 2016.
And no complications with
No.
with the surgery?
Nope, so now I'm just on levothyroxine.
Okay. Do you take any other daily medications?
I take the oral contraceptive, the levothyroxine. I take a multivitamin and then sometimes a probiotic.
Okay, and you take the levothyroxine by itself early in the morning on an empty stomach? Very good. So the Tapazole, is that listed as an allergy for you?
Mm-hmm.
Any other medication allergies?
No, not that I know of.
Any food allergies?
No.
Any allergies to latex?
Yes.
Okay, so I'll be sure to use latex-free equipment. What about your family history?
So my dad, he just has a history of high cholesterol, so he's just taking Lipitor for that. My mom has a history of hypothyroidism. She has Hashimoto's, so she is on levothyroxine as well. And then my sister, younger sister, has a history of asthma and thyroid nodules, which have been biopsied before, but they've been benign, so they're just keeping an eye on that.
I see, and you don't have any other history besides the thyroid removal?
Correct.
Okay, and do you still live at home with your parents?
Yes.
Okay, and you feel safe at home?
Yes.
Do you feel any thoughts of harm to yourself or others?
Nope.
Okay, very good. It's important if you do start to have those thoughts to seek counseling, to come into the office. If it's all right with you, I'd like to continue with the physical assessment.
Sure.
I'm just gonna have you roll up your sleeves and your pants.
Want me to take my socks off too?
Yes, please. So your skin appears clean, dry, and intact. The color is appropriate for ethnicity. Your fingernails and toenails are manicured, no clubbing or cyanosis. Your hair is evenly distributed with no bald spots, appears thick. Your neck is symmetrical. I do see the scar from the surgery, which appears to be healing well. I'm now going to palpate your temporal arteries, which are equal and regular. I'm going to take a listen as well. Excuse me. Very good. I'm now going to palpate your sinuses. I want you to tell me if you feel any tenderness. No tenderness?
No.
Very good. I'm now going to palpate your jawbone. I'm going to have you open and close your mouth. Very good. No cracking or popping noted. I'm now going to feel for your lymph nodes. Tell me if you feel any tenderness. And open your arms. No tenderness?
Nope.
Very good. Nodules are small, mobile, no swelling. I'm going to have you stand up now. I'm just going to palpate from behind your thyroid gland, which you don't have. So I'm just going to feel for any masses, which you don't have. Again, the area heals very well. You can have a seat. I'm now going to palpate your carotid arteries, which are strong and regular, bilaterally. I'm also going to take a listen. Very good. Very good. So next, I'm just going to take a look at your eyes. I'll put some gloves on for this. So your outer eye looks clean, no drainage, no redness. Okay, I'm going to palpate your eyes. Okay, no tenderness or swelling in the eyelids. Sclera is white, conjunctiva is pink with no redness. I'm now going to test your muscles in your eye. So I'm going to have you follow my finger with just your eyes. Very good. Muscles are intact. I'm now going to take a look at your pupils. I'm going to have you look straight ahead. Oh, my battery is dying. Just use this. Again, look forward for me. Okay, pupil is equal and reactive to light. I'm now going to look at your optic disc inside your eye. If you can look straight. Okay. Optic disc is yellowish orange and with sharp edges. And same with your right eye, yellowish orange with sharp edges. I would then just test your visual acuity by having you look at a Selin chart. I'd have you read from top to bottom every letter to the best of your ability. And when you were unable to see a row clearly, that would tell us what your visual acuity would be. I'm now going to take a look at your ears. Your external ears are clean, no drainage, no redness, with a piercing to your left ear. And take a look inside your ear. The tympanic membrane is pearly gray with good light reflex. And again, same with your right side, pearly gray with good light reflex. I'm now going to perform what's called the whisper test. I'm going to have you turn away from me towards the door. And I'm going to have you rub that little piece of cartilage in your ear for me. I'm going to say 3, letters or numbers, and I just need you to repeat after me.
1, 5, 7.
Very good. Can you switch ears?
A, 8, 9.
Very good. Next, I'm going to perform what's called the Weber test. I'm going to strike the tuning fork against my hand and place it on the top of your head. When I place it on the top of your head, I just need you to tell me if you can hear the sound equally in both ears.
All right. Yes.
Very good. I'm now going to perform the Ryan test. I'm going to strike the tuning fork again and place it behind your ear on your bone, and I need you to tell me when you stop hearing the sound.
Okay. Okay. Okay.
Very good. So air conduction is greater than bone conduction, meaning there is no hearing loss. I'm now going to look inside your mouth, or I'm sorry, your nares. Can you block one nostril and blow out? And the other side? Any blockage?
Nope.
Able to breathe normally?
Yep.
Very good. I'm going to take a look inside.
Okay.
Very good. Other side. Nasal mucosa is pink with no deviation to the septum. I'm now going to test your sense of smell. If you could close your eyes for me.
Mhm.
I'm going to place something under your nose, and I just need you to tell me what you smell.
All right.
Or the scent you smell, rather.
Mint.
Yes, very good. You can go ahead and open your eyes. I will now be moving on to your mouth.
Okay.
Excuse me. I'm going to have you open your mouth, stick your tongue out. Excuse me. Can you move it up, down, side to side? Very good. Tongue is symmetrical with easy movements. I'm going to have you open your mouth nice and wide. Oral mucosa is moist and pink with no abnormalities, no masses. I would then test your gag reflex by using a tongue depressor and pressing the back of your tongue or your throat to elicit a gag, which most people have. I will skip that part for you. Now I'm just going to palpate your carotid arteries again. Very good. I'm going to have you go ahead and lay back. I'm going to assess for any jugular vein distension, which you do not appear to have. Can you turn to your left side, please? I'm now going to palpate the point of maximum impulse on your chest, which is easily palpable with a regular and strong pulse. I'm going to have you lay flat on your back. As I already assessed your carotid pulses, I'm going to test your brachial pulse, which is strong and regular. Good, strong and regular. Now your radial pulse. Good. Again, strong and regular. And your femoral pulse, which is strong and regular. Very good. Your popliteal. Strong and regular. Bilaterally. Your posterior tibial. Strong and regular. Your dorsalis pedis is also regular and strong. I'm going to have you sit up for me. I'm going to take a listen to your heart. Okay. The S1 and S2 heart sounds were heard equally in the aorta. aortic, pulmonic, Erb's point, tricuspid, and mitral points. I'm now going to listen for any abnormal heart sounds. No abnormal heart sounds noted. I'm now going to have you lay back one more time for me. I'm going to first listen to your renal arteries. And your aorta. And now your iliac arteries. And your femoral arteries. Very good. You can go ahead and sit up. I would then check your capillary refill, which with your manicured nails I'm unable to do. But with a clean nail, if you press firmly to blanch the nail, the color would then return in less than 3 seconds. I'm now going to place my hands on your back to check for any fremitus. Have you say the word 99?
99.
Very good. No fremitus notice. I'm going to have you take a deep breath now. Very good. Chest is equal and symmetrical. I will now have a listen to your lungs. Nice deep breath. Very good. All lung sounds, lung fields are clear. No abnormal lung sounds. I'm also now going to listen again with you saying the word 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99, 99, 99, 99, 99.
Very good. No bronchoscopy noted. I'm now going to percuss in the same spots on your front of your chest and your back. Very good. Resonance was heard throughout the lung fields. I would then check your pulse oximetry with a machine that would then go on your finger, but with your nail polish it would be hard to do, so we'd have to remove your nail polish. A normal pulse oximetry is usually between 95 and 100. I'm now going to have you lie back to examine your abdomen. Abdomen is soft and flat, non-distended. I'm going to take a listen to your bowel sounds. Bowel sounds are active in all 4 quadrants. I'm now going to percuss your abdomen. Just tell me if I'm hurting in any way. Very good. Overall, over the abdomen, tympany is heard throughout. I'm now going to percuss for the liver. dullness is heard over the liver span. I'm now going to percuss for the spleen. Tympany is heard over the spleen, indicating that there is no enlargement of the spleen. I'm now going to lightly palpate for any tenderness, if you could tell me if I'm hurting it. Any tenderness?
No.
Very good. I would then deeply palpate for your liver. I would place my hand on the back side of your of the patient and deeply palpate while the patient's taking a deep breath to feel for the liver. I would then do the same on the other side for the spleen. Put my hand in the back and deeply palpate. Most spleens are unable to be palpated unless enlarged. I'm going to have you sit up now. I'm just going to check your back for any tenderness. Any tenderness there?
No.
Very good. No CVA tenderness noted. I'm now going to check your joints, which appear symmetrical with no bony prominences, no swelling. I'm going to test your range of motion in your neck. I'm going to have you put your head forward and back and turn your head from side to side. And if you could place your ear to both shoulders. Very good. I'm now going to have you press against my hand and the other way and side, side. Very good. Range of motion and strength in the neck is all intact. I'm now going to test the range of motion in your shoulders. I'm going to have you hold out your arms straight and then behind you. Very good. And across your chest and the other way. Very good. Range of motion is intact. Now I'm going to have you press against my hands. Very good. Strength in the shoulders are now intact. If you could hold out your arms, I'm going to test the strength in your arms. Don't let me push down. Don't let me push up. Very good. Now the elbows. I'm going to have you straight and bend. Very good. And then turn both ways. Very good. Range of motion in the elbows is also intact. Now I'm going to test the range of motion in your hands and wrists. I'm going to have you flex down and extend up and turn in and out. Very good. Range of motion is intact. You can now squeeze my fingers. Good. Grips are strong and intact. I'm now going to have you hold out your hands one more time. Just don't let me push. Very good. And the other way. Very good. I'm now going to have you stand to test the range of motion in your spine. I'll have you lean forward. Very good. And lean back. And lean to your sides. And twist. Very good. Range of motion in the spine is intact. I'm now going to test the range of motion in your hips. I'm going to have you flex your leg up and extend back. And do the same with the other leg. Very good. I'm now going to have you hold out your leg and then push it out and then in. And same with the other leg. Very good. I'm now going to test the strength. Have you push against my hand. Very good. Another way. Good. Range of motion is intact and strength is strong. I'll now have you sit. I'm going to have you straighten and bend your knees. And the other one. Very good. I'm now going to have you push against my hand. Very good. Very good. I'm now going to have you flex your foot and extend. Other foot. Good. And straighten your toes and curl. Very good. I'm now going to, don't let me push down. And like a gas pedal, push on my hand. Very good. Strength is strong and range of motion is now intact. I will now be testing your reflexes. Let's start on this side. And if you could let your knees dangle. Very good. All the reflexes are intact. I'm now going to have you put your heel down your leg from your knee down, just like that. Very good. Movement is easily performed without difficulty. I'm now going to have you walk across the room, just normal. Gait is normal with regular balance. I'm now going to have you walk toe to toe. Gait is steady. I'm now going to have you walk on your toes. Very good. Gait is again steady, balance is good. I'm now going to have you walk on your heels. Balance is good, gait is steady. I'm now going to have you take a seat and touch your finger to your nose. Very good. And the other side. Very good. I am now going to have you put your hands on your lap and just flip them up and down. And the other hand. Very good. Rapid alternating movements are easily performed without difficulty. I'm now going to test your sensation in your arms and legs. I'm going to have you close your eyes and tell me if the sensation is sharp or dull, if it is soft.
Sharp. Sharp. Dull. Dull.
Very good. I'm now going to, again, have you close your eyes and hold out your hands. And I want you to tell me if I'm putting your finger up or down.
Down. Up.
Okay, and sit back a little. I'm going to do the same with your toes.
Down. Up.
Very good. Now, keeping your eyes closed, I'm going to place an object in your hand, and I need you to tell me what it is.
A battery.
Very good. And I'm going to have you hold out your hands again. Give you one more object.
A cotton ball.
Very good. Now, continuing with your eyes closed, I'm going to write on your hands a number or letter. I just need you to tell me what it is.
A.
Yep.
8.
Very good. Your senses and neurons seem to be intact. Can you tell me where you are right now?
At your office getting a physical.
Very good. And can you tell me the year?
2019.
Very good. So you are alert and oriented ×3. I'm now going to test your attention. If you could count backwards from 100 by 7.
100. 93. 86. 79. 72. 65.
Very good. You can stop there. I'm now going to test your comprehension. I'm going to give you a piece of paper. I just need you to do what it says on the paper.
Okay.
Very good. So your attention and comprehension are intact. Can you tell me what you did for your birthday last year?
I went out to dinner with my friends in Boston.
Oh, nice. Where'd you go?
Bava, which is an Italian restaurant.
Oh, I'll have to check it out.
Mm-hmm.
So your long-term memory is definitely intact. I'm now going to test your short-term memory by giving you a list of 4 words.
Okay.
The words are cat, dog, 1, 2.
Okay.
Can you now count backwards from 20?
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
And can you repeat the 4 words that I mentioned?
Cat, dog, 1, 2.
Very good. So your memories appears to be intact. Your assessment was very, very good. Do you have any questions for me?
No.
Okay.
Sorry.
Well, thank you so much for your time. I hope you have a good day.
Thank you. You too.
Thank you.